Welcome to the Clinical Pharmacist podcast, where we discuss interesting topics related to clinical pharmacists in general practice. My name is Runa, your host, the clinical lead of CPS and the training and development manager of Clinical Pharmacists Academy. And as always, we do have our co-host Mahmud.
Hello everyone, my name is Mahmud. I'm a clinical pharmacist, independent prescriber, and I'm the founder of Clinical Pharmacist Solutions, and I'm the managing director.
So for today's podcast, we're actually shifting perspective in this episode because today's guest is not a clinical pharmacist, but is actually involved in the management and support of PCNs and is also the host of the Business and Healthcare podcast. We're really excited to have with us today Tara Humphries, who is the founder of THC Primary Care and has been in the primary care field for 6 years. Welcome to the podcast, Tara.
Hi, thank you so much for having me. I feel nervous. I'm not used to being on the other side.
I'm sure you'll be just fine. Thank you so much for joining us today. So I know you're very accomplished and you have many skills and roles in the primary care field. Please tell us a little bit more about yourself.
So I've got my own business. I've got a couple of employees and also a bit of contractors, and we provide interim network management support to primary care networks, and we also provide training and facilitation and consulting to networks. And I'm also part of the NHS England Time for Care team, where I support practices and networks and federations with quality improvement.
I see. Okay, that's fantastic. Right, so let's get straight into it then. Can you tell us what your experience with pharmacists has been like in the general practice sector? What's your experience been like?
So it's been really, really positive. I'm really lucky that the networks that I have worked with and currently work with, we have recruited some amazing pharmacists. So I've been very lucky in that respect. But I suppose from a management perspective, understanding what a pharmacist can do and embedding them into the team and understanding the levels of experience has been it's not been a learning curve. It's just new to me, but it's been very, very positive.
Tara, I know you've been involved in supporting clinical pharmacists in PCNs. Can you tell us more about what support available for PCN pharmacists?
So what we've been doing is just trying to make sure we give them a really good induction. We've got some pharmacists that have got a general practice background, so they've got a slight advantage on the pharmacists that are coming from a community background. So it kind of, even before they start, it's really working with the practices to help them understand what the role can do and understanding their experience, building the induction plan. And then we've been looking for training. And I heard you guys on the General Practice podcast with Ben Gowland, and we'd been looking for training. And I don't even think I finished listening to the podcast. I was like, yep, that's what I need. Went onto your website. It's really self-explanatory. Said to Tahira, who's kind of like our lead pharmacist, have a look at this. What do you think? She was like, yes. So in regards to training, we've used you guys. We also go to our training hub. So I would advise people to contact their local training hub to see what support that they can provide. There's also in Redbridge, where I'm currently supporting, they've got forums, and we link very closely to people in the CCG to offer them support. And I think on Fridays, there is like a pharmacist forum. So I think it's a combination of going out and looking for training organisations like yourselves, speaking to training hubs, working closely with the CCG, and also just linking with other forums that are going on. That's been really, really helpful to me.
So that's fantastic. I think pharmacists do need extra support when they first start, especially, with the pharmacists who never worked in general practice. You mentioned training hubs. Is that something that's available for all the pharmacists nationwide, or is it just
no, everywhere?
Your area?
Everywhere. And I think that's kind of where I started my kind of primary care experience. So everywhere, every CCG area will have a training hub. A bit like PCN, some are more mature, some are like all singing, all dancing. They offer everything. Some don't. It really does depend, but I think that it's a good place to start. And a lot of that training will already be centrally funded via Health Education England.
See, okay. Well, the role is new for pharmacists, but it's also new for GP surgeries as well. So can you tell us more about the challenges that the pharmacists face and also the challenges that the GP surgeries and PCNs face once they employ the pharmacist?
I think that from a primary care network-based point of view, the organisations, if you'd even call them that, the networks are so new. So I think there's a challenge of time. So every area is recruiting pharmacists, but I think some networks may underestimate the time it takes, not because pharmacists or any roles are really, it's not bad, but I think if you're going to introduce a new role, a brand new role where they're not just working in one practice, they may be supporting, in my case, 8 practices, making sure that they've got all of their IT, people understand, the scope of their role, what training is in place, how are they going to supporting their desk specifications. It's that time. And I'm having a conversation today with Tahira where we're talking about your structured medication reviews and what needs to be in place and, what's the time allocation. So all of that needs to be worked out. And I think it's a challenge for networks if your clinical director is pulled in millions of directions and you may not have a network manager that has got the time. I think new roles would struggle in that respect. And I think the role of a pharmacist in our area, it's not brand new. We have got pharmacists in general practice. I think it's time and trust. And, we've introduced our pharmacists in the middle of a pandemic where they're working from home. So they're not building the rapport and those relationships you would do if you were working in just one practice. So I think that is a challenge lots of people have to face. It's not unique to pharmacists, but working virtually. And I did a review with our pharmacists and said what's working well. And they all said working from home. But then they did say, I do want to go into practice. They do want to go into practice, but they like the fact that they can work from home. So I think that is because they know that they'll be able to achieve what they want to faster because they'll be there.
I see. Okay, brilliant. Thank you.
So Tara, I know you've been in the industry for quite a few years now, and we have said that, the pharmacist in primary care and general practice, it is a relatively new role. And for that reason, it's a developing role as well. And from your exposure to pharmacists and just being in the primary care field, what's it like now having pharmacists as part of the practice team? I mean, is there anything possible now that wasn't possible before pharmacists came along? Have you seen any changes?
So I would say that they bring a level of just different expertise. And so as an example, we're reading through the DES around the specification for structured medication reviews. And Tahira just asks questions that just don't get asked, usually, because she has got that level of expertise. And I think what they bring to the primary care network, and I don't know if I should say this, but it's that they're funded roles centrally, and they come in and they make the practice money. So it's just, if it was my business, I would want as many pharmacists as I could get my hands on. So they bring a different level of expertise. They reduce they increase capacity for the clinical staff, and they generate income for the practice. So I think that it's a no-brainer. It's been extremely positive, and it is positive.
I see. I've certainly met pharmacists who do make a big contribution toward the GP surgery, earnings. They do obviously increase the access for patients to a healthcare professional. But also, I know a number of examples like that where the pharmacists come in and have that big impact on the practice. You're absolutely right.
So, Tara, what qualities would you say that you look for in a pharmacist? When you see a pharmacist come in, what sort of qualities stand out in a pharmacist?
So I would say the qualities I currently have I say my pharmacists, they're not mine, but they feel very attached to them. You need to be patient. So patient. I think that's probably the main one. I think it is just being patient. If you're working across multiple practices, you may not be able to hit the ground running as fast as you would like. So being patient, being flexible are the main ones. I always say to network staff coming in, first comes trust, then comes change. So, You have to be quite proactive and let people know that you're there. Some people will just be like, yep, crack on, off you go. And some may be harder to crack. So I think you just have to be resilient. You have to make yourself visible, which is different and difficult when you're working virtually. But just come with, like any member of staff, just come with a can-do positive attitude. And in regards to, I suppose, promoting PCNs, I absolutely love it. Sometimes, like any job, some days it's very tough. But I couldn't imagine doing anything else. I wouldn't want to do anything else at this moment in time. I think it's, for new pharmacists coming in, I think it's really exciting. You can shape and mold the role and, be a leader and quickly be seen as that person. You become indispensable really quickly, because once they understand the scope and the expertise that you bring, if you're a good cultural fit in their network, they'll hang on to you. Like one of our pharmacists wanted to leave for personal reasons. I was like, you're not going anywhere. Like, how can we make this work for you? Because we wouldn't want to lose her.
Yeah, that's absolutely right. Because now GP surgeons are becoming dependent on this pharmacist as well, because we frequently get asked to cover, maternity, sick or holiday times, absence in GP surgeries.
So Tara, what advice would you give to a pharmacist, first starting out in primary care roles? And what advice can you give to pharmacists wishing to transition into this sector?
I'd say be patient, reach out to kind of other network pharmacists. There's loads of you guys out there. Kind of ask for what you need, and you might not get everything that you need straight away, and you have to kind of see it from an organization's point of view. But I think be very very vocal. We have like one-to-ones with our pharmacists, and we have group meetings, and make sure you've got adequate support around you, and be vocal and request and ask your network manager, your clinical directors, clinical leads, what it is. Make it known what you need to be able to do your job to the highest standard. And that may be training, that may be clinical supervision, it may be having an informal mentor, and just, I suppose, just come with a can-do attitude. There'll be some pharmacists listen to this will think, yep, I'm off to a flying start. Some of you may not all have that experience, and it may be a little bit difficult, but I would say just stick at it and just stay close to your clinical directors and ask for what you need. What resources do you need to be able to deliver your job to the high standard? Because they may not know. So I think, just request, be patient, be proactive.
Thank you. And that's fantastic advice. And on that note, with regards to the support networks, for that very reason as well, we found that pharmacists, especially starting out in a new role, they did struggle a little bit at times when they didn't have the correct support network or the right support network around them. So we've actually recently launched our Telegram group called Clinical Pharmacist Network. And, we've got myself there, we've got Mahmud there, and we've got plenty of other really experienced pharmacists. And the aim of the group is basically just to support pharmacists, whether they have any clinical queries or with regards to how do you find this on System 1 or EMIS and all sorts. So I encourage all pharmacists who are looking for that support network around them, they can easily get that from our Telegram group, and you can find the link to that on our website. So it's open to all pharmacists in the UK.
Cool. I'll have a look. I'll let my team know.
Thank you. Well, Tara, it's been a pleasure speaking to you today. It's been really nice to get your perspective on things, and you've also given us some great advice too. All the best to you, and please continue the great work that you do supporting PCNs. Thank you.
My pleasure.
This podcast was brought to you by Clinical Pharmacist Academy, supporting pharmacists to transition into the general practice sector and accelerate their career as a clinical pharmacist. For more information about our academy, visit cpaweb.org.uk.